back together again. We are going to review, is it H481?
Yep.
And that is a bill relating to public health initiatives to address death by suicide. We have Katie McGlynn here, in the Office of Legislative Counsel, to walk us through.
Thank you. I don't even need to introduce myself now. So what I'm sharing with you is not the formal version as passed Senate, because it just was voted on third reading, at lunchtime, I want to say, today. So it'll take a day or two before we get the formal version. It was messaged over today to the House, so that might speed things up a little bit. So what the Senate sent back to you was instances of amendment. And I can try to walk you through and give you some context. If you are able to pull up the as passed House version, that will help you to see it in context.
That's House version.
You'll have to compare the two documents as we go. I'll try to help.
3.1.
Yeah, so 3.1 was the Senate amendment, and then as passed House is the underlying bill that they were amending.
I wonder if it's easier to have the underlying bill up there and then but I guess everyone's different. Never mind.
Okay, Katie.
Okay, so the first section of the bill that you sent over created a section on the duties of the Director of Suicide Prevention. And you had language in your underlying bill, the last sentence of that section was that the director shall expand partnerships, implementing innovative data-driven initiatives, coordinate suicide prevention programs across the state, and work to secure federal funding. So if you are looking at the Senate version, you have the first instance of amendment rewrites that last sentence. It really doesn't change the context too much. I've made it into a list because it started to get a little bit confusing. The new language is including, so expand partnerships, you had that including with service members, veterans, and their families. So that is really the substantive change.
The expanded partnerships.
Expand partnerships is part of your draft. And then after that, they've added including with service members, veterans, and their families. And then I created that sentence to be a list because the sentence started to get kind of unwieldy, and I thought it would be easier to see and take in this way.
Katie, do you want us to ask questions right after you finish?
Whatever works best.
How do you want to do it? You want to ask questions right after the changes? I do. Okay, so that's what we'll do.
Okay.
Any questions about that change?
So I'm understanding because it's just not yellow, so I'm just trying to combine them. I'm sorry. So the only thing that's added is service members, veterans, and their families to section 1. That's the only thing?
Mm-hmm. And then it's just structured differently. Yeah. Yes. Okay.
Thank you, Katie.
You're welcome. So we'll move on to what is the second instance of amendment. In the underlying bill, the House version of the bill, section 2, this was a section on the strategic plan and school protocol. And then you have subdivision A1. Should I just read this subdivision so you remember what is in A1? Would that be helpful? So by July 1 of 2024, the director, in collaboration with AHS and stakeholders, shall develop and submit a statewide strategic plan pertaining to suicide prevention, services, training, education, and post-vention services to the policy committees. The statewide strategic plan shall identify goals, possible partners, and strategies for meeting clearly defined targets in the prevention of suicide. Key resources and gaps shall be identified, including sustainable 988 Lifeline funding, zero suicide program, expansion, improved data collection and reporting to identify contributing causes, including social factors, to inform prevention strategies and data-informed systems and strategies for establishing and maintaining post-vention services within communities, schools, healthcare systems. So really we have two amendments in this section. The second and third instance of amendment are in that subdivision A1. First, you're inserting what would be the third sentence. So if you count down, our first sentence ends with Senate Committee on Health and Welfare. Our second sentence is on, what is mine, line 11, define targets in the prevention of suicide. Then there'd be a new sentence there. The plan shall consider emerging research on factors contributing to suicide. And the last sentence of that subdivision, where we have to inform prevention strategies and data-informed systems and strategies for establishing and maintaining post-pension services within communities, schools, then I would say after-school programs and healthcare systems. So that's where we're adding after-school programs to that list. Next.
Any questions?
Sorry.
I have no question, just a comment. I think they really wordsmith this with stuff that is unnecessary, but that's just a comment.
Okay, go ahead, Dave.
Okay. So we're still in section 2, which is still our strategic state plan and school protocol. So if you're looking, so we've moved out of subsection A, now we're looking at subsection B, which is on page 3 of the as passed House version. The existing language that the House passed is that on or before January 15th of 2024, the director in collaboration with AOE and stakeholders shall develop and submit a model protocol for all schools regarding suicide prevention, education, and post-pension services to the policy committees. They are proposing to add this second sentence here that says the model protocol shall reflect preliminary data related to grants to expand mental health and well-being services to youth pursuant to Act 112 of last year. So there was a youth mental health grant program that was enacted last year. So this is asking that the preliminary data that's coming in to inform the model protocol. And secondly, to ensure that school employees receive education pertaining to the prevention of use of language regarding and identification of eating disorders in youth.
Okay.
And just for everyone's benefit, I just emailed you all the report that this language was taken from. We'd like to do more around eating disorders.
Eating disorders, okay.
Yeah, we've got this in, yep.
So you put the language in here?
The Senate did with the help of advocates, one of whom is in the room right now.
So this subdivision 2 reflects some of the recommendations that were made in that report. And in our next instance of amendment, we're cross-referencing the report. So section 3. Oh, we're adding a whole new section 3. Okay, so this is a new section that is not in the House version of the bill. So just as we had a model protocol for schools, this adds a protocol for healthcare facilities. So by July 1, 2024, the director, in collaboration with AHS, medical and professional boards and stakeholders, shall develop and submit a model protocol to the various policy committees for healthcare facilities regarding suicide prevention and post-pension services. This model protocol shall consider the recommendations of the report required pursuant to Act 115, Section 3. So that's referencing the language that requires the report on eating disorders from last year. And then we're renumbering to be numerically correct. And that is it. That's what the Senate sent over.
It's the same.
Everything else is the same.
Questions?
I have reactions, but not questions.
Go ahead.
My reaction is that this language to me feels like that it is incredibly narrowing the focus of some of the activities that we were hoping to empower the director of suicide prevention and their team to go out and gather. And I, for one, am not in favor of giving anyone cuts in line because mental health impacts so many people in our state. And as a parent, I complete, and someone that, you know, suffered with mental health challenges in my youth, I completely appreciate the urgency of supporting youth in our schools and our educators with tools to help them. But I also think that it is incredibly unfair to prioritize people in legislation and statute. So I'm sorry, but I just think that that would be fair to support someone coming first in line.
Which part are you referring to, Daisy?
The
Section 3.
Third Amendment, yeah. Section 2, statewide suicide prevention, strategic plan and school protocol. So we're also potentially looking at impacting our schools without looking at funding to do that. That's another issue, right? We didn't take any testimony on that. Model protocols for schools. This is all great work, but I think the intent of this committee originally was to charge and empower that director of suicide prevention to work with stakeholders across the state to say, where do we need to go? What's the map? And to look at a broad cross-section of our state and collaborate with them and lift up all those voices, not to focus on specifically youth and school protocols.
Okay, let me ask you this. Under Section 2, where it says prior to submission of the plan, the suicide prevention director shall submit quarterly progress updates on the development of that plan. Does that not provide that person with the opportunity?
Where are you?
With them on page 2. Small
282.
It's line, at least on mine, it's line 10. Prior to submission of the strategic plan.
May I ask Daisy a clarifying question?
Sure, go ahead.
Just to see if I'm understanding correctly. So section 2, you're right. I mean, we've basically tasked with like
Yeah,
all
they didn't change that.
all continuum of life, not just schools. And then we have a section in schools. Are you saying that by their addition, that they're limiting our entire section 2 down to just focusing on youth? Is that what I'm hearing?
I think it's narrowing and specifying the direction that the director would work in. And I think we hired someone that I think we should empower to advise us using their expertise. I don't think we should specify to them where we want them to look. They should be advising us on where the issues are, and they should be elevating stakeholder voices to do that.
I agree with you, but they're going to have to prioritize something. You know, if you have a director, they got to start somewhere. And I do believe the schools are first, but I don't want to stop there. Like you say, we can look at all avenues of this.
Katie, can you help us with this? Do you feel that the amendment that the Senate has reduces the director's ability to do what Daisy's talking about?
I think that the language does. I mean, if you look at subdivision 1, the model protocol shall reflect preliminary data. So it's sort of taking lessons learned and building that into the model protocol. And I think some of the conversation in that committee around adding this language was that this language was, a short-term grant program that was created. And often, there's a tendency to put money behind an initiative and, never have it sort of woven into the fabric of, how state government functions, or we sort of forget the lessons learned and we move on to the next thing. So that was the conversation and rationale that I heard when they added that particular subdivision one, that they wanted to make sure that we didn't lose I keep saying lessons learned, but the lessons learned from implementing this particular mental health grant program for youth.
Thank you, Katie. Daisy, how do you feel about that?
Curious to hear from others.
I'm sorry?
I'm curious to hear from
Oh,
others.
yeah, okay,
I am,
go ahead.
I don't know if I don't know if it's just that I'm struggling today, thinking. I'm having a hard time putting their changes into where it is.
Yeah.
Do you think that you could take that and could you read for us what we've got and then read it with their?
Yes.
The subdivision B or subsection B?
I think so, yeah.
Okay.
And I'm really curious about I'm still not quite sure where the plan shall consider emerging research on factors contributing to suicide. I'm not sure where that actually is going into either. I'm just having a hard time wrapping my brain around it.
Should I start with this school one since we're here?
Yeah.
Okay. So this is section 2 of the underlying bill, subsection B. I'll read how it would appear altogether. On or before January 15th, 2024, the Director of Suicide Prevention, in collaboration with the Agency of Education and stakeholders, shall develop and submit a model protocol for all schools regarding suicide prevention, education, and postvention services to the House Committee on Healthcare and the Senate Committee on Health and Welfare. The model protocol shall reflect preliminary data related to grants to expand mental health and well-being services to youth pursuant to Act 112, Section 3, and ensure that school employees receive education pertaining to the prevention of, use of language regarding, and identification of eating disorders in youth.
More discussion?
I'm sorry, can you take, can you take me back to the amendment? And just
Specifically
where
for eating
is
disorders.
the additional language is where?
If this is subsection B, it would just be added as a sentence.
Back to ours, page
One at a
2.
time.
Which is an amendment?
One at a time, please.
That's the fourth instance of amendment that we're looking at.
Thank you.
Mhm.
Okay. Daisy.
If you go back to, Katie, that was section 2 you just read us, right?
I just read section 2B. Yep.
So Alyssa, on our original, you go back to section 2.
Yeah.
Like I'm reading through that and I just feel like it's much broader. It's about a statewide strategic plan to identify gaps. And I think 988 is and zero suicide is the only specific things that are called out, specific programs and initiatives.
I agree. I'm willing to, because it's section B, and section B is really just dealing with just schools.
Yeah.
I'm kind of willing to let that go, but you're really right though, in that, we had it very broad about that they shall develop and submit a model protocol, but then the amendment comes in and it says the model protocol shall reflect the preliminary. It's almost like we're saying, we're not saying come up with one, we're saying come up with one and it should be this one.
Yeah. I agree. Yeah.
It should include the,
Well,
Can it be written so that it's not meaning to replace, but include?
that's kind of what I was thinking. I mean, if it said you know, you should take this into consideration.
I don't want to have it be may, though. I do want them to include it, but I don't want it to replace what we asked for in the bill that left the House.
In the bill that left the House, we talked about the collaboration of the human services agency, stakeholders, and,
That's right.
yeah, so we asked for that collaboration. Do you feel, Katie, that it's still in there, or should that be added so that it captures what we're talking about right now?
Sounds like you're moving away from the language on line 3, the model protocol shall, and you could instead say something like, in developing the model protocol, the director shall consider preliminary data and,
Yeah.
I don't know what this.
Okay. But I think it goes into line.
Yeah, I mean, this has, I would,
Oh, go ahead.
No, go ahead, finish.
Yeah, finish.
I would
She's on, yeah.
caution us because there are things in here like ensuring that school employees receive education pertaining to the prevention of and use of language regarding the identification of eating disorders in youth. That has financial implications, like if we're ensuring specific training. I just think that we can't put that in without implying that something is going to be funded, a specific training. And I think also when you're this descriptive about a report, you're also boxing in who's actually going to be able to do this work. And I think we can't be that prescriptive about contractors that are going to perform a report or support the agency in performing a report or analysis. Sorry, Leslie, I interrupted you.
No, not at all. I just want to make sure I understand. So section B still stands from the original report. That is unchanged. And what's added is the Senate is asking to put additional things in these additional things in the report. It's not changing B. I guess that becomes B1 and this is whatever.
No, it
losing track
doesn't.
of that.
Yes, you're right. It doesn't become B1. It just is an added sentence. But I would just remind you, it's not a report. They're coming up with a model protocol that schools could adopt.
Right, but it doesn't change B. B still stands
B still stands with an additional sentence.
with an additional requirement. That they're requesting this additional requirement. It doesn't change overall B. So the question is, do we have, I mean, I see your point about it might add money, but we don't know. So do we want to go forward with this? I guess I'm just thinking, do we want to back and forth? Or do we want to just do this and have them come back and say, this is what we learned by trying to implement this?
Okay. You're next.
I like the way, Katie, the language that you were starting with to change instead of the model protocol shall, whatever you started with, I like that. As far as the education, I get it that you have to be careful about unfunded mandates, but education does not have to cost extra money either. I know as a nurse educator, I provided new types of education than what we had provided the year before. And it was with the existing resources that we already had. I know it takes time, but it could, the model, whatever model they have, could be a preliminary effort that wouldn't be extensive training. It would be providing information, education.
Okay, thank you.
Pretty much the same thing. Education, it shouldn't cost any extra to the educational system. They have in-service, they have education problems. Doesn't need to be a dollar figure. Eventually, maybe, but I think it's very important in school. I mean, I want to be in the schools. And then anything else, widen the horizon to everything. But I think I'd hate to put the whole thing in jeopardy for this.
Yeah, I mean, I think that should be in our schools too, but the fact is, teachers have so much time,
Oh,
right?
no.
And I think without taking testimony on like, what is the plan for implementing this? And also, I think our director of suicide prevention has so much time. That's one person, right? And so to give them a specific order on a project on top of the specific project that we had already agreed upon is a pretty heavy marching order. And this is one we haven't even discussed. Maybe some people have, I haven't.
It might not be a teacher though that does it. It could be, it's up to the school. It could be the school nurse. It could be an administrator who provides the education. It doesn't have to be a teacher.
Okay.
First, I apologize for coming in late, so I'm just getting some clarification here. So on B, it says, shall develop and submit a model protocol for all schools regarding suicide prevention, education, and postvention services. And now the Senate is asking, the model protocol shall reflect data related to grants to expand mental health and well-being services. Are we okay with that one? Is it just the second one we're worried about? Are you worried about 1 and 2?
We're worried about the whole thing.
Okay, so hold on.
Yeah.
So the way I read it, we're already requiring the model protocol to include education in B. And so we're just expanding it to eating disorders. Am I reading that correctly or incorrectly, Katie? You're specifying that that has to be one of the things that there is education on.
And the rest of section, excuse me.
That's fine.
Madam Chair. The rest of section 2 stays the same as it was. Is that correct?
Well, we talked about some changes in A1. But that is the only change to B, is adding this sentence.
Yeah.
Can I finish for a second? Real quick, what's the changes to A1? They're adding after school to the list on the last sentence of A1. Community schools, after school, and healthcare systems. And there is the addition of a sentence midway down that paragraph. It says the plan. Oh, I'm sorry. They're adding, not us. Yes. Okay. Sorry. I was wondering if we already decided we're adding.
No decisions.
Okay. Gotcha. So the decision on whether or not we accept their language all has to do with that second piece. Correct? Model protocol shall.
Yeah.
Okay.
Can you repeat your language, Katie?
Yeah, so this line 3 that's up on the screen would be changed to, in developing the model protocol, the director shall consider preliminary data related to grants and maybe something like education for school employees pertaining to. Yeah, I mean, I would say, and again, I'm sorry for not listening to this whole conversation, but coming in and just looking at this, I would say I'm okay with including both of the sections as long as it's in the same framework of what we had in B.
And that's kind of my point, is it's almost like the way that this is written, it takes our B, which was very broad, and we wanted them to do this comprehensive plan around prevention, postvention, all of this work with the schools. And then it seems like this language basically then narrows it to, and this is what the model protocol shall be. It shall be reflected on is this, and it should be about eating disorders.
Exactly.
And they'll come back to us with,
A list of grants.
yeah.
So is that how, interpreting it correctly? This language is saying that you're developing a model protocol, and the model protocol is going to address these things specifically.
As well as other things.
It doesn't say that.
But that's the question. Is it addressing everything plus this or only this? And I guess that's where I'm struggling.
The first sentence is like giving discretion and saying you're coming up with a model protocol. When you do that, make sure that these things are in it.
Right, so the model protocol is regarding suicide prevention and post-prevention services, and it shall consider the recommendations of the report required pursuant, and it shall have these two things in addition. So it's not taking away from our original intent in B.
No. No,
Okay,
it's not. But I think the problem is, Daisy, correct me if I'm wrong, you feel that adding that additional task on the director is, you don't think you'll be able to do it. Is that what you're saying? That it's adding too much work, or it's too much work for him?
I think that, one, we haven't heard testimony from the person whose job description we're adding to right now, right? So this is for the Director of Suicide Prevention.
This is for the Director of Suicide
Yeah.
Prevention.
In addition to whatever they've been doing so far.
did, but not enough to say.
And that to be said, like, I'll still vote on this regardless. And I think, you know, to Alyssa's point, I think it really narrows the conversations that he is able to lead in that role. And I don't like giving someone a job as important as that and then narrowing their ability to lead some of the most important conversations that they could have in this state with stakeholders. I agree that, you know, youth, mental health, and eating disorders are, you know, one of the most critical conversations to have, and empowering school staff is so urgent right now. But there are other critical and urgent needs out there. And so why do these folks get to be prioritized? Who decided that?
Okay, so
I understand what you mean.
can I make a suggestion?
Yeah, go ahead.
Where is this in the Senate?
This has come to you.
Is it on our calendar?
Not yet. They had third reading today and then they expedited it coming back over here.
Okay, Claire, can we see if we can get our Director of Suicide Prevention in either this afternoon or tomorrow between the floor sessions? Okay, let's hear from the Director of Suicide Prevention. How about that?
I'm wondering, it's some of the bills we get where they're like the lines are it's underlined where it's changing and then highlighted. Will we get one like that? Because it's hard, or is that not something?
You won't get that for this.
So we can just do that ourselves, because I just feel like I'm still trying to grapple with how everything reads together, and I just want to be able to see it as one.
Yes.
So committees have a choice to send back a strike all
Okay.
for instances of amendment. When they do instances, it's usually because the changes are more narrow.
Okay.
So even when you get the final Senate proposal, it will look like this. And then when you have a bill as enacted, it will be integrated, so you will have already voted and left by then.
All right, so I'm going to print it, make it myself, because I'm still trying to grapple with how it all fits.
If this passes, do we revisit this?
Of course we can.
Yeah.
Yeah,
Okay.
of course we can. But I think since we have a couple minutes, not a couple minutes, but
Yeah.
very short window of
Right.
time, we can try and get
That's
the Director
fine.
of Suicide Prevention.
Okay, so we're gonna just leave this on the table the way it is until we speak to the Director of Suicide Prevention.
I have a question about that. Who does he work for?
Mental health.
Department of Mental Health. Okay. Thank you.
He was in here earlier.
Oh, yeah, I remember him well. Yeah.
He'd be a good kid.
I mean, we haven't heard a lot of testimony on eating disorders.
No, but there was a report that was, the Human Services took testimony last year and required a report, and that's what this is based on. And eating disorders is on the rise in females, and
It is, but when we added that amendment, I kind of felt a little funny about it because I want all disorders recognized.
Right.
So I They said, well, we're specifying which ones.
Right. It's suicide prevention too. So I want to know if that is one of the main
Yes.
factors. I want to know because I didn't.
And others.
It is.
And other things that,
So I'm also going to throw out one more thing, and this is something we have to grapple with once we hear from the Director of Suicide Prevention. We could make changes and send this back to the Senate, and then they don't move it.
Yeah.
So we have to be willing for it to not move this year if we make changes.
Can we take it out?
And they could, it has to go back.
Yep.
They could choose not to.
Change anything that comes back to them.
Right. And really tomorrow's kind of our tomorrow Monday is our last day to, if we want them to take action, and they may, I know this is very important to the Senate, so they could choose not to move it till next year.
Let's look at I'll look at their page and see who they
That's what I'm
took
trying to-
testimony from, because this is the first I've seen.
That's exactly what I'm trying to find.
So it was in the building last year, so it is the first time you're seeing it this year, that's for sure.
Would it be helpful to talk to Ginny or?
They're done, actually.
So let's talk about this offline.
So let's talk about this offline.
No, we're not done yet. Yeah, I'm gonna take over.
Okay, go.
Well, I had asked another question which wasn't pertaining to the section that we were gonna go back to.
Oh, okay.
I was hoping that you could refresh where that sentence.
Sure.
Um,
Do you want me to read all of A1 together?
It's the last.
Yes, please.
Okay, let me pull that up. Okay. So it's the second sentence. Right there. Okay. 2A1, on or before July 1, 2024, the Director of Suicide Prevention, in collaboration with the Agency of Human Services and stakeholders, shall develop and submit a statewide strategic plan pertaining to suicide prevention services, training, education, and postvention services to the House Committee on Healthcare and to the Senate Committee on Health and Welfare. The statewide strategic plan shall identify goals, possible partners, strategies for meeting clearly defined targets in the prevention of suicide. The plan shall consider emerging research on factors contributing to suicide. Key resources and gaps shall be identified, including sustainable 988 lifeline funding, zero suicide program expansion, improved data collection and reporting to identify contributing causes, including social factors to inform prevention strategies and data-informed systems and strategies for establishing and maintaining postvention services within community schools, after-school programs, and healthcare systems.
Thank you. That was really helpful, actually, to me.
All right, so we'll come back to this. Thank you, Katie. Yeah.
I'm just seeing that they didn't seem to take any testimony about eating disorders.
They may not have.
Yeah,
but
I'm just,
they're-
so, yeah, for sure, but that's why, to try and understand.
Thank you. You're welcome. So we need to go back to 206 and 230 and do our straw or committee discussion and straw vote. So any thoughts, comments? Thanks, Katie.
I'd like to make a comment or a thought. The change on the security of firearms was exactly what I had advocated for in this committee when we discussed it. That was what I thought we should do if we did anything, is to not make it a lot of lock up your guns, but make it a penalty if something happens with it. So I'm not voting for it, but that's a.
You can take credit. Anyone else?
Can I make comments about it?
Yeah.
So, I mean, I obviously followed this very closely in the Senate. They modeled, the original, what we had in there was modeled on Connecticut's safe storage. They took out that and basically copied and pasted New Hampshire's. I don't think we should aspire to be New Hampshire in this particular case, but I understand why it's in there, and I think it really addresses actually a lot of some of the concerns that some people have around constitutionality of it. I'm pleased that they left the bill as unchanged as much as possible. And I still think it's a strong bill. I will also make mention that I'm not in love with the clear and convincing. The rationale that we make a state's attorney who is adept at the law only have a preponderance, and yet we put a family in a situation where they have to have a higher bar. But I do think it's important because I think that this is data that can be collected and we can revisit it at some point if it's not used. If we're seeing that families are actually petitioning the court and they're being turned down, that's data that we'll be able to get. But I'm fully in support of the bill as amended, even with my slight hesitations on things.
I'm a no. I just don't think in 2 years or 3 years, the suicide rate by whatever is not going to change. We're band-aiding and I don't think it's the right thing. So I apologize, but my vote will be.
No, you do not apologize for your votes at all. Okay, all those in favor of concurring on H 230? 1, 2, 3, 4, 5, 6, 7. All those not in favor? 3. So 7, 3, 1. Thank you very much. So that will be on the floor tomorrow. 206 is still in the Senate. It'll be a couple days.
Okay, so even though we voted, we don't have to tell the
We don't
clerk's office.
do anything
So
until,
someone needs to tell me when I have
look
to.
on the calendar, keep following the calendar in the Senate. And then it'll be on our calendar for a day as notice.
But don't we have to let them know that to notice it? I mean, that's what it's gonna be. I don't know this.
No, so when we concur with the Senate,
Okay,
what we'll have, so tomorrow will be a good example. So it's on the 2:30 is on the notice calendar today. It'll be up for action tomorrow. And Alyssa, sounds like Teresa for some reason. Alyssa will stand up and make a statement and do our straw vote, and then Martin will stand up. And so,
yeah, no, my question is that how does it get on the notice calendar? It doesn't come from us.
no, it comes from the Senate right onto the notice calendar.
That's
Yeah.
what I.
Yeah, so just follow that. So thank you, everyone. We will find out what we're doing with the Director of Suicide Prevention and look back on that tomorrow. So unless we haven't reached him yet. Okay, so possibly, I said we wouldn't come in tomorrow morning, but possibly we'll come in at 9:30 if he's free in the morning. Otherwise, we'll do it in between. But I want to make sure that we do something tomorrow on 481, so we keep it in motion.
So 9:30, you said?
Tentatively, watch your email.
All right.
Yeah.